The STD, STI that I feel like is the most common and one that should be most talked about, because I feel like it's not taken as seriously as it is herpes. There's two types of herpes. The first is HSV1 and the second is HSV2. HSV1 is cold sores or just mouth herpes, and then HSV2 is genital herpes. Approximately 1 in 8 people, ranging from 14 to 49, have herpes HSV2. That is the genital herpes. And because it is so common, I feel that a lot of people don't take it quite as seriously, but it is still a sexually transmitted infection, so there should still be precautions taken. It usually is spread through direct contact, whether that is like on the mouth or the mucosa of the mucosa surfaces, or if that is with sexual intercourse. You can also have HSV1 be transmitted to HSV2 by any sort of oral sex that is performed. So that is something that is not very, that isn't often talked about, but it is there and it is a common worry. With signs and symptoms, they can kind of range. Usually with HSV1, it is pretty obvious that if you have a painful sore in your mouth, and usually there's creams and everything that you are able to put on, but they are not always, they don't completely get rid of the virus. They just kind of help it, and then they will eventually go away. They're called flare-ups. So with flare-ups, you're going to have itching, burning, if it's HSV2, you're going to have, a painful sensation when you're urinating. And then also, you can have fever and swollen lymph nodes with both of the HSV1 and HSV2. So it's very important to make sure that you are taking care of yourself during any outbreaks. There are also going to be painful sores and blisters with HSV2, so it's not usually going to be one sore blister, it'll be multiple, which it's very noticeable down in that general area. And then for symptoms of men and women, they're typically the same. They're both sores and the fever and painful urination and everything. Usually you're able to self-diagnose herpes, although it is it's recommended that you would go in and get either a blood test done or a PCR test done to make sure that there is, which is antibody testing, to make sure that it is actually herpes and not anything that is either more serious or it might not be anything at all. Some people will mistake ingrown hairs for a herpes outbreak. The most people that are at risk are young adults and adolescents, especially those that are not using proper protection, such as condoms, and they don't have much education on any sort of STIs or STDs. There's no cure for herpes. It is simply treated with antiviral medications such as anything that is over the counter. It usually is not available just like in the pharmacy. The best way to prevent herpes is just with using condoms when having any or doing any sort of sexual activity, and also that includes oral sex as well. If you have a cold sore yourself, just do not perform that or avoid any mucosal contact. Although it is also, there are sheets of condoms that are available for those who are still wanting to perform oral sex. And make sure that the condoms are worn, like I said. It is honestly recommended to just completely eliminate it. Herpes is only transmitted and able to be spread during the time of an outbreak. So if there's no cold sore, you cannot spread a cold sore. However, the same thing with HSV2. If there is no flare-up, not like flare-up or spots, then there's not going to be any herpes transmission. Then also, some people get flare-ups every month, every couple of months, every year. Some people get them once in their lifetime and never get them again. Herpes is very broad, so there's not every individual's case is very different, and some people don't experience a fever or anything. So just knowing and making sure that you are aware of the symptoms, and when they arise, that you take action upon them is very important. So that is my spiel.